Good evening, everyone, and welcome to another segment of Supporting a Healthy Lifestyle. Today, we'll be discussing type 2 diabetes from beginning to end, prevention, cure, and kidney disease. Let's open with a word of prayer. Father God, thank you so much for your blessings and your protections for each of us today. Please continue to be with us as we listen to a wonderful presentation from Caren. And thank you so much for her willingness to provide us with this information, and also Dr. Porteous. Please help us to be listening, attentive, and to retain and apply all that we hear today. Father God, thank you so much for everything that you've done for us, and please provide a special blessing to everyone under the sound of my voice. Amen. So today we're having two presenters on type 2 diabetes. First, I'll start with Dr. Caren Fadlin. She is a Caribbean-trained physician who is licensed to practice within her region. She has over 12 years of combined clinical experience in emergency and family medicine. She also has many years of experience providing preventative health care. Through the powerful tools of weight management, whole foods eating, and other lifestyle changes, she has helped patients improve chronic disease outcomes such as lowered blood pressure, improved diabetes control, and lower cholesterol levels. After Dr. Caren Fadlin also holds a master's degree in public health, specializing in management of health systems. Her current focus is on population health. She provides oversight for the New Jersey Market Hospitals of Prime Healthcare Management, guiding CMS programs, and focus on improving the quality of patient care. After she speaks, our second presenter will be Dr. Haldane Proteus. He is the medical director of ARC's newest dialysis center in Winter Haven, Florida. He is the staff nephrologist for the Glesser Clinic, also in Winter Haven. Dr. Porteous completed his nephrology fellowship at the Johns Hopkins School of Medicine in Baltimore, Maryland. He is board certified in internal medicine, clinical hypertension, and nephrology. Dr. Porteous holds a master's degree in patient safety and leadership from University of Illinois in Chicago, Illinois. He has received many honors and awards during his medical career. Dr. Porteous has written peer-reviewed articles and has completed many state and national scientific posters and oral presentations. At this time, I would like to welcome Dr. Caren Fadlin.
Thank you so much, Jeanette, and what a pleasure it is to be with you all this evening. Thank you so much for the opportunity to share. We will be having a really important discussion today looking at type 2 diabetes from its very inception and all the way to the end, and how it can impact our body systems. So in this presentation today, we will present it in two parts, where I will focus on looking at type 2 diabetes and an all-important aspect of it, looking at prevention and cure. We'll go over the risk factors of diabetes, and we'll definitely look at the lifestyle practices that are associated with disease prevention, as well as sustaining a cure for that disease. We'll also look at the long-term complications of the disease. In part two of the presentation, we will focus and zone in on one of the specific complications of the disease, which is kidney disease and kidney failure, looking at the link between that and type 2 diabetes, and looking at a number of management factors as well as how it impacts our life. So a very important and exciting presentation for you today. So let's talk more about type 2 diabetes. Diabetes in and of itself actually affects about 34 million Americans. That's about 1 in 10 Americans who will have diabetes. And type 2 diabetes is actually the type that more than 90 to 95% of persons with diabetes has. So in general, a lot of persons who have diabetes are going to have type 2. It's usually seen in people who are over the age of 45 years old, but more and more we're seeing that it is prevalent in the younger population. There's certain groups of people who tend to have a higher prevalence or a higher likelihood of having this disease, and that is African Americans who have about 11.7% of this group has diabetes, and Hispanic Americans also 12.5%. And this is based on CDC data from 2017 to 2018. So about 1.5 million new cases of diabetes were reported in 2018, which means it's a condition that is continuing to be relevant, and more people are suffering or being impacted by this very serious disease. There's also an important group of people who have something we call prediabetes. And prediabetes, as its name suggests, is where you have diabetes that is coming into being, but you're in that prodrome phase before the diabetes actually manifests itself fully. And about 88 million people 18 years or older have prediabetes, and a lot of times it goes unnoticed. They do not know that they're actually suffering from this. And in the group that is 65 years and older, about 24.2 million of these people have prediabetes. So significant in terms of the burden of the disease. Now, we talk about diabetes quite a bit, and I think that some persons are maybe not even fully sure what diabetes is all about. So, what exactly is diabetes? How can we break that down in simple terms? So, diabetes is a health condition that negatively affects how your body turns food into energy. Okay, so we eat food, and from that, we're expected to be able to move about. But in diabetes, that process is actually impaired. It is generally thought to be long lasting. So in general, when somebody gets diagnosed with diabetes, they're of the thought, well, this is with me forever, and I'll probably have diabetes, for the rest of my life. And in truth, in many cases, this is what happens. Most persons who become diagnosed with diabetes eventually get on medication, and are on medication, whether it's tablets or insulin or some form of insulin, for a very long time, usually for the rest of their lives. And it's a serious condition because it's associated with very significant diseases, namely heart disease, kidney disease. You have visual impairment. A lot of our body organs are actually involved. So let's go a little bit more closely to find out what actually happens in type 2 diabetes. What is happening inside our bodies? So you can use this diagram to help you understand. So basically, you will eat food. It will come down this tube called your esophagus and get into your stomach. And then eventually what happens is, once it gets into your gastrointestinal tract, that food is broken down into simple sugars. Okay? That's the essence of it. It's broken down into simple sugars, and that gets absorbed into the bloodstream. At the same time, that triggers another organ in our body called our pancreas to release a substance called insulin. Okay? And insulin basically also combines with that, or rather goes over to the end organ. So for example, in this case, your muscle or your liver or whichever organ in your body requires energy, and it kind of acts as a key that opens the cells in these organs and allows the glucose or the sugars to go into your body cells, and that provides them with the energy that they need to function. That's what happens when everything is going normally. However, in type 2 diabetes, what we see is most of the process remains the same in terms of food being broken down into sugars, getting into our bloodstream, and even still stimulating that pancreas to release insulin. However, when it gets over to the cells, we're finding that that key that insulin serves as does not work as well. And we're not finding that the sugars are able to get into the cells. So what we end up with is an excess of sugar in the bloodstream. That sugar in the bloodstream in excess is toxic, and that is what really triggers a lot of the complications that we see with type 2 diabetes. So if there's one particular conclusion you make, that maybe sugar isn't good for our cells, that would be a very good conclusion that you have made. It is not good for your cells if it's in the bloodstream. We want it to get inside so it can form energy. Now, what are the risk factors for type 2 diabetes? Okay, well, we spoke about pre-diabetes and we'll go into that a little bit more. But if you're in that pre-diabetes or just before fully being diagnosed with diabetes stage, then, you are at risk of developing full-blown diabetes. Then anyone who is overweight or obese, they're also at risk of developing diabetes. And there's actually more and more studies coming out that's showing a very strong relationship or correlation between obesity and overweight and type 2 diabetes. And then in general, what we're finding is that persons who are age 45 or older have this likelihood of developing diabetes as well. But as I mentioned before, we're seeing that the age for developing type 2 diabetes is getting lower and lower. And believe it or not, it has actually been seen in children as young as 2 years old with type 2 diabetes. And as you can imagine, the earlier on that it is diagnosed and occurring in the body, especially if it's not managed very strictly, then you can imagine that the complications begin to occur earlier and the long-term effects also occur earlier. If someone in your family has had diabetes, especially maybe a parent or a sibling, then you're also more likely to have it because you have that genetic correlation. And then persons who tend to be sedentary, so they're having either no activity or very little physical activity, are also at risk. If you are a mother who during your pregnancy had gestational diabetes, meaning diabetes during pregnancy, many times that diabetes goes away once you deliver the baby. However, having had gestational diabetes puts you at higher risk of developing type 2 diabetes in the future. And as I mentioned before, your ethnicity also has an impact on that. So African Americans, Hispanic Americans are in that high risk group, and also Native Americans. Native Americans actually have the highest rate of diabetes. Up to 33% of that population actually have type 2 diabetes. And some individuals may go to their doctor, they may have their routine physical done, and they're told they have non-alcoholic fatty liver disease. That has also been associated with type 2 diabetes. And has a lot to do with central obesity. And so again, you see the obesity inflammatory factor being significant here. So how do I know if I already have it? So, maybe you haven't been diagnosed with type 2 diabetes as yet, but you would like to know if you do or do not have it. Well, let's go into how we diagnose it. So you have type 2 diabetes if you have a positive test on 2 separate days, and I'll go into what those tests are, or if you have one positive test with symptoms. And we have different tests that we employ for testing for diabetes. And this one here that you see, the A1C or hemoglobin A1C, really has taken the lead in terms of what we use as physicians to not only determine if you have diabetes, but also monitor it over time. So a normal result for your A1C is going to be if that value is less than 5.7. Okay, that is a normal value. The pre-diabetes stage is where your A1C is between 5.7 and 6.4. So those of you who may have gone to your doctor and you're in this stage, remember I said that this is definitely not the stage of complacency, but certainly a stage where you'll need to be active because this is the pre-diabetes stage. And then diabetes is formally diagnosed if you have an HbA1c of 6.5% or greater. Okay, there are 2 other tests that we use. One is the fasting plasma glucose test, where you fast overnight and then the following morning we will check your blood glucose level. And if your value is under 100 milligrams per deciliter, that's regarded as normal. If it's between 100 and 125, we think that's the pre-diabetes stage. And certainly if it is greater than 126 milligram per deciliter on 2 separate days, then we will think that you have diabetes. A third test that is also done is the oral glucose tolerance test. And this one has values that are a little bit higher in terms of what we look at in the range as compared to the fasting plasma test. But it's basically where you're given a glucose challenge, a certain amount of glucose to drink, and we check your blood glucose level after that. And if it is in any of these ranges, meaning 140 to 199 or 200 and over, we think that you will have prediabetes or that you will actually have diabetes. Now, remember, I also said that you can have one positive test associated with symptoms, okay? And we can use that to make the diagnosis of diabetes. And I want to go into what some of these symptoms are so that you can be aware of them. So they are, urinating often, having a feeling of extreme thirst or extreme hunger, even though you've eaten. Some persons may find that they're extremely fatigued or that their vision may be blurring. And a really important telltale sign is if you're having cuts and bruises that are healing very slowly. Or if you have tingling or pain or numbness in the hands and feet. So oftentimes it's going to be a combination of them. And obviously there are other conditions, including normal conditions that may have you experiencing some of these. For example, if you drink a lot of water during the day, obviously you'll be urinating very often, but you'll be able to determine, well, I haven't really had that much water. Why am I going to the bathroom so frequently? Why am I still feeling very thirsty even after I have had something to drink? I just ate. Why am I still feeling so hungry? And essentially these things are happening because of that high glucose level in the body, and also because your cells are starving for energy because the glucose is locked out of the cells. Okay, and then the cuts and bruises healing very slowly is another telltale sign that you could potentially have diabetes. So my suggestion to you is, if you have any of those risk factors I mentioned before, and you're noticing any of these symptoms that I have listed here, it's a good idea to check your doctor to see whether this is a challenge you might have. Now, it's important to know, for those persons who are thinking, okay, well, it runs in my family, or I'm overweight, obese, what can I do to prevent it? Maybe you're sure that you're not diabetic right now. What do I do if I want to prevent or reverse even becoming pre-diabetic? The first thing I want you to recognize is that pre-diabetes is actually a part of the diabetes spectrum. It's not something that exists in isolation or on its own. Okay, it's a spectrum. And if you look at this graph that I have here, you will notice that really, especially as we're looking at these different tests, that you go from normal into pre-diabetes into diabetes. Is that fluctuation that happens. It's not that discrete. And so what you will find is that the symptoms of type 2 diabetes may be the same symptoms that you're having in that pre-diabetes stage. And it's good to be aware that pre-diabetes may or may not show symptoms. Okay, so some persons, and in many cases, a lot of people who have prediabetes are not aware. And this is another reason why it's important to have your annual checkups with your physician, because that is how you'll be able to tell, what is going on within your body if you may not have symptoms. Another important thing to know about prediabetes is that the negative effects on your organs may have already begun. Okay, so prediabetes should not be viewed as this zone where everything is okay and I can just stay in that pre-diabetes zone and I'm fine. You can actually have some of those negative effects of diabetes happening in that pre-diabetes stage. And if you're saying, okay, well, how do I prevent myself from becoming pre-diabetic? Or how do I reverse pre-diabetes if I already have it so I don't develop full-blown diabetes? It's important to know that the same strategies that are applied if you have established diabetes are the same practices that you will apply if you're in that pre-diabetic zone. And so what are these changes? What are these lifestyle habits that you can employ and that you can put into practice that will help you to prevent yourself from getting type 2 diabetes? And here they are listed here. Well, one of them is definite to get more physical exercise. More and more studies are showing that the more physically active we are able to ward off those negative effects that can lead to diabetes. And then we want to have a lot of fiber in our diet. Fiber and whole grains. These have actually been shown to be directly linked to lowering our blood sugar levels and helping us to ward off diabetes. And then number 4, losing extra weight. This is a very critical one, and we'll go into that a little bit more because even modest weight loss can have a significant impact on whether you develop diabetes or not. And then number 5, is really one of those that I want to highlight because it does impact points 4, 3, and 2, and that is not just to make healthy food choices, but to embrace healthy food choices. Sometimes we make the healthy food choices with resentment. Oh boy, another salad. Oh boy, this is not real food. But if we begin to embrace the benefits of it, then I think it will make our transition or sustenance of that particular lifestyle habit more a joy than a burden. And so, as we speak about burden, understand that managing stress is another very important key to preventing type 2 diabetes. And we'll go a little bit into that. We need to stay motivated because oftentimes stresses are real and, our motivation might wane. And then also, stress is one of those things that if we don't solve those problems, then we won't be able to progress in the direction that we'd like to go. So right now I want to go into each of these in a little bit more detail. So how exactly is physical activity beneficial to you for preventing type 2 diabetes? And how much of it should I really be getting? So you want to aim for, every day would be great, but if you can start at even 3 to 5 days per week for 30 minutes or more, that is great. Now, I know saying even 3 to 5 days per week for more than 30 minutes a day, for some sound like a burden. Where am I going to find the time? I really don't have that much interest. I want to do it, but I wish the activity would just kind of happen on its own. All of these thoughts. My suggestion is start where you are. Even if it means you start with 5 minutes a day, do that. Moving from 0 to 5 minutes a day is helpful. My experience is that as you begin to start, even starting slow, you'll get into the rhythm and you'll be able to increase from there. But just start. I'm sure each person, no matter how busy you are, can say, yeah, I can find 5 minutes. 2 days a week, I can find that. Start there if that's where you can. And then you can aim to increase with time to getting to this ideal of 3 to 5 days per week for 30 minutes or more. And what can you expect to be the results of this kind of physical activity? Well, one of them is that it will help you to lose weight. Now, losing weight, believe it or not, regular exercise is not the best way to lose weight if that's what you want to do. We'll get into that in a little while, but certainly it can help you lose weight, and it's far more important for helping you to maintain weight that you've lost. Another thing that exercise helps you to do is to lower your blood sugar. Okay, so be aware now that making yourself physically active will help to lower that blood sugar level and at the same time boost your body's sensitivity to insulin. Your cells will be able to process that insulin better. This is what the studies are showing us when you are exercising. Remember, we did talk about that high level of sugar in your blood that is toxic. Now we're able to lower that blood sugar level because we are exercising more. Our cells need more energy. We're utilizing it in that way. And certainly if our bodies are more sensitive to insulin, then that obviously, remember, insulin is that key that lets those sugars go into the cells. Then you can see where your blood sugars, meaning the sugar level in your blood, will get lower and begin to approach that normal range. Now, the question may be to some, okay, what kind of exercise should I do? Okay, now you really do want to have a combination of both aerobic exercise and resistance training. Both of them can be beneficial to helping you to lower your blood sugar levels. So your aerobic exercises are those that are going to be the ones that keep your body moving. So swimming, running, walking, cycling, all of those are regarded as aerobic physical activities. And in terms of the resistance training, we're talking about, those where you talk about, muscle building or whatever. So you're talking about using weights or these bands, as the case might be, to help in muscle tone and so on. That is generally regarded as resistance training. I think that if you had to choose one in terms of a place to start, it's always going to be better to start with aerobic exercises, because resistance training, you really do need to be consistent with that over time to begin to get that benefit. But certainly each person's body is different, and we have seen that different people respond to different types of exercise, meaning aerobic versus resistance, in a different way. But that would be my general recommendation, to start with aerobic exercises. Now, what is this that I'm saying about eating fiber? Okay, I mean, whatever could be the benefit of eating more fiber and whole grain except making us regular? Well, certainly there are lots of benefits. And we're so happy that we have these studies that are coming up showing us that when we include fruits, and I'll mention which fruits shortly, vegetables, beans and whole grains and nuts, these foods are high in fiber, and we definitely want to incorporate them more in our diet in order to increase that fiber content. And it's a pretty significant amount of fiber that we need. So we're talking about 40 grams or 9 servings per day. Imagine yourself having 9 servings of fruits and vegetables per day. Some people might say, well, I only get in 2 or 3 meals per day. But in general, if you look at your plate and see what's on it, then you begin to get the picture. So a typical diet for most is you're not eating well unless you've got a good amount of that starchy item on the plate. So that could be like rice or potatoes, or some kind of pasta or so on, and that must take up a good chunk. And then for some, you need a good portion of protein, and that could be a meat kind for some, or for those who are vegetarian, it's going to be like a bean option. And then many times in terms of vegetables, it's like decorations on your plate, so not so much. So you want to really switch that around. Some persons may be doing really a lot better in terms of balancing the proportions of food on their plate, but you want to be weighing heavily on vegetables, and we'll talk about which ones are beneficial. You want to have those non-starchy vegetables, which are much lower in calories, and similarly for the fruit, we want to have fruit that are lower in their what we call glycemic index, so more of those watery fruits with lower sugar levels, and then also include all these whole grains, and I'll give you great examples of those. So what are some of the top whole grain foods? If I would suggest some, I would say wheat, and I do recognize that some persons may have an allergy to that, and so there are definitely other options. We've got barley, quinoa, oats, brown rice. These are some of the options there that you can employ for whole grains. Certainly, if you're going to be doing, looking for weight management, you will want to be careful that with the whole grains that you choose, you have less, for example, of brown rice. So don't use that as your reason to say, well, Dr. Fadlin said, brown rice is great, so I'm going to eat a lot of that. Remember, we got to put the whole picture together. And if we're finding, especially that we're looking to minimize our weight, then erring in that direction heavily is not going to be helpful. Okay, so obviously for some persons, putting it all together and getting the picture right, they may need the help of a dietitian or a diabetes specialist to kind of help them to figure out what the portion sizes are going to look like and provide guidance. Okay, so fiber may also help you to do these things. It's gonna reduce your risk of diabetes by improving your blood sugar control. Okay, a lot of these are complex molecules, complex carbohydrates, and what that essentially means is that it breaks down so much slower in your blood so that the glucose isn't released all at once but released slowly, and that really helps with blood sugar regulation. And that is far better than having some of those more processed foods like white rice, white flour, even some of those really starchy vegetables as well, which can shoot your blood sugar up really high and expose you to not the best of blood sugar control. And so similarly, it can help to lower your risk of heart disease and also promote weight loss because it's going to help you to feel full. Okay. Now, I want to let you know that in my practice, I have found that weight loss is a cornerstone for type 2 diabetes prevention. Okay. And it's obesity is a major risk factor, but I don't want to just rest on obesity where you have a BMI that's 25 or more. Some persons who are in that overweight category, maybe even the lower end of overweight category where their BMIs are 25. Sorry, I think I mentioned 25 for obesity before, but 30 or over for obesity. A BMI of 25 to 29.9 is that overweight category. And even if your BMI is within there, you should not feel very comfortable with that, especially if you are having whether a blood test or symptoms that suggest that you're in that pre-diabetes zone. Okay, the studies have shown that obesity and also overweight increase insulin resistance. And what that means is that your body is not as sensitive to the insulin, and therefore you're likely having these higher blood sugar levels, which can of course lead to type 2 diabetes. Okay, and so one of the things I want you to recognize is that even in these eating habits that I'm talking about, which are aimed at weight loss, type 2 diabetes prevention, I believe, is really so closely hinged to weight loss and these other habits that I've mentioned. And so you want to lose weight and keep it off. And the studies are showing, and we have several of them showing that, losing even 7% of your initial body weight can actually help you lower your risk of developing type 2 diabetes by as much as 60%. That's a significant reduction. And what it also means is you don't have to lose a tremendous amount of weight to do it. Some people believe that, well, if I don't lose 20 or 30 pounds or maybe 40 pounds because of where I am, it's not going to work. But even 7%, so that means for somebody who, for example, weighs 200 pounds, if they lose even just 14 pounds and come down into the 180s, they will find that in and of itself makes a significant difference. So I don't want you to be deterred by the concept of weight loss. It is possible, but I do want to stress that it is really important. I've seen over and over again this very strong correlation between maintaining a lower weight and having those blood sugar levels come down. Okay. Recognize too that regular exercise is also essential because regular exercise helps you to maintain the weight that you've lost. So what you will find is that your diet and your diet plan, so how you manage your food, how you proportion your food on a daily basis, is important to achieving that weight loss. When you're talking about maintaining that weight loss, exercise is really very helpful. And so you may have someone who decides, oh, I need to lose weight. Let me go exercise. Let me go to the gym. Yes, that is important, but some persons frustrate themselves because they're like, I'm going to the gym, 3-4 days a week, and I'm working out for an hour. And, after your workout, you're like, I did such good work. I'm going to go treat myself to something really nice to eat. And in a couple of weeks, you're like, I don't know, I'm frustrated. No weight is coming off. And that's because you're relying too heavily on exercise for that weight loss. Now, certainly, if you do intense exercise, maybe 2-3 hours per day of really high energy exercise, that can be a significant source of weight loss. But that's generally not the direction that most take, and maybe a little bit too much for most. And so what we recognize is by reducing the quantity of food that you eat, where your body's daily energy demands are not met. So you have less food than your body demands, then you have this calorie deficit, and that allows you to lose weight. And so we come right back to what we eat. You cannot gain weight typically, right, for the average person, unless you are having foods that are causing you to gain that weight. And I think it's important to recognize that it's not necessarily so much how much food you eat, as it is important the types of foods that you eat, because you have some foods that we call calorie dense, meaning a small amount of food, but it's really so high in calories. So things like fatty foods or oily foods, oils have 9 calories per gram. Okay. And you definitely want to watch that. And then also you have small amounts of food, so like chocolates, um, uh, you know pastries, those kinds of foods. Alcohol, of course, we definitely want to stay away from that. Those foods are definitely higher in their calorie content, even though they're small amounts of food. Now, what sometimes people get attracted to is, let me just go on this kind of quick fix diet where I'm just going to go on this program and I'm going to try to lose the weight and, hope that it will just stay off. Short-term weight loss programs, especially the ones that are very extreme, can definitely work to help you lose weight. And it can, if you're disciplined enough, help you to lose a lot of weight in a short space of time. However, they're oftentimes not sustainable. In other words, you go right back to the old habits that you've had, and especially if they're diet plans that prevent you from getting all the vitamins and nutrients that your body needs, you're going to end up with these intense cravings and then want to veer back to the foods that you've had before. And then oftentimes what may happen is when you go back, you may even gain more weight than you had lost initially. So if you're doing a weight loss program under the guidance of a professional, that is helpful, because they will not only help you in terms of that weight loss plan, but they will also help you to transition into a permanent lifestyle change that is sustainable. Okay. And so that's what you want to do. You want to eat smartly, a well-balanced diet that is portion controlled. And what you'll find is that you want to shift into having lots more vegetables and whole grains, and I'll look a little bit more on that on your plate, and less of these other foods that are higher in their calorie content. So my tip for you is to start cultivating a love for low calorie vegetables, fruit, and whole grain. And I have to say, cultivating that love, because I know many times, people are doing it and it's with a little bit of resentment because they feel that they're losing something by giving up the things that they used to have before. And if you find that that is your challenge, I'm going to ask you to pray about it, that you can help to make that transition. And I found that, for those who are able to make that mental transition, adopt that lifestyle for a period of time, then their body begins to have less of these cravings for those high fat, high salt, high sugar foods, and it begins to level off into feeling more comfortable with those low calorie foods. And so I wanted to make sure that I provided you with helpful examples of what these are, rather than a vague kind of alluding to what they are. So foods here, so these the diagram on the left really represents a lot of these vegetables and fruit that tend to be lower calorie ones. So you're talking about broccoli, okay, and you're looking at others like carrots and asparagus, mushrooms for those who enjoy those, cucumbers, spinach is a really significant one as well. You see celery on this list as well. Okay, garlic, a lot of you will probably use that, and this is another one that has far-reaching effects, but certainly being one that helps to lower blood sugar is one of them. And then in terms of the whole grains, here I have a lot of great examples for you. Oatmeal is at the top, and I do like that it is, because I think this is one of those very great options. Is really a very good option, especially for breakfast in the morning. And one of the things that I want to encourage you to recognize is that these foods, especially these whole grains, are packed with protein. So a lot of times people are moving towards a more vegetarian diet, and they're like, oh, well, I'm not eating meat now, so where am I going to get the protein from? These are packed with protein. So if you look here, for example, at oats, you will see that it has 17 grams of fiber per cup and 26 grams of protein. These are high level protein content. And then again, it's often said that if you're not eating meat, then you're not going to get enough iron. Look at how much iron it has in it. 41% of the daily amount of iron that you need, you get from oatmeal. So, whatever misconceptions you had about whole grains, I want you to take a snapshot of this if you need to, so you can have it to reference, and just remind yourself that all these great foods that the Lord gave us, these vegetables and these grains, are great to help us to keep healthy. And they have very far-reaching effects in helping us to prevent type 2 diabetes and pre-diabetes. And so I also want to stress the importance of stressing less and getting support to achieving that as well. It's really so important. You want to make sure you find out what is causing your stress. Many times you have this situation where you have different stressors going on in your life, and whether it's work related or home related, but you definitely need to figure out what is causing your stress and look into solving those problems as in a very significant way. And because if you have a chronic stressful situation, then it's going to slow your progress down. Okay, if you're not solving those problems, that's going to slow your progress down, and it's really important for you to stay motivated. Another important thing to recognize about stress is that it's not just this thing in your head, it's not just this concept, but when your body is under stress, it actually releases certain hormones. Cortisol is a major one of those that actually causes an increase in your sugar levels. Okay, so it can put your body out of control from a sugar level perspective. And the second thing is that cortisol can also increase your weight. So stress is not a figment of your imagination. It does require that you pay attention. Another important thing is to get adequate sleep. Sleep is not a concept. Sleep is not a nicety. Sleep is a necessity. There's a reason God created our bodies, that it needed to have downtime and rest. That's when your body recuperates, rejuvenates. You feel fresh and ready to go. When you're sleeping, your body does a lot of correction of all the different, negative processes that have happened inside your body. One of them, believe it or not, is making cancer cells. Every day we make cancer cells, but our bodies have a mechanism to destroy those. So recognize that getting adequate sleep is really important for your body to have the time to use the energy, not on moving about or doing these different activities, but to actually cleanse itself, recuperate, and rejuvenate. You want to get 7 to 9 hours of sleep. Okay, I understand. 9 hours, what are you saying? But even if you can err on the 7 side, do your best to get that. Figure out what your stresses are and try to solve those problems. Surround yourself with people who have similar goals and want to achieve those goals, not naysayers who tell you that it's not possible, or it's an unachievable goal. You definitely want to be working towards that, and you'll find that even surrounding yourself with people who have similar goals is going to be helpful to help you overcome these challenges. Okay, so here are some ways that you can actually manage your stress I mentioned one, getting enough sleep. Exercising regularly is a way to manage stress. For some persons, journaling, writing about their experience is also helpful. Spending time with loved ones, meditating. These are things that help to support, stress management. But you must recognize that at the real foundation of stress management is to look into solving whatever issues you may have in your life. And if it's something that is not as easy to find a solution for, then you may need to weigh a little bit more heavily on these factors, but definitely consider it seriously. So, okay, but can type 2 diabetes really be cured? So if I have it already, I'm on medication already, can I really achieve a cure? And the answer is a wholehearted yes. It is possible. And there are so many out there who have been able to reverse this. Remember, now we have parameters that define what diabetes is. So they've been able to lower their HbA1cs, into some of them into the pre-diabetes zone, some of them back into the normal zone. We've actually seen that bariatric surgery, certain types of them especially, have been associated with reversal of type 2 diabetes. And part of that obviously is achieved through the weight loss that bariatric surgery allows. So we're talking about being able to achieve that same level of weight loss with lifestyle changes that we're going to sustain. It's really important to recognize that a cure is not a quick fix. It really requires a lifelong commitment to change every single day. So this is not a solution in a bottle. And for those of you who do have type 2 diabetes and are taking medication, I want you to recognize that that does not cure you. It does help to control the diabetes to some extent. And believe it or not, many persons who are on medication for type 2 diabetes have not achieved HbA1cs that are in the normal level, or sometimes even in the pre-diabetes level. Their HbA1cs are, a good one is 7. So I'm saying, even if you're on medication for type 2 diabetes, employ these changes and you will find that your values begin to normalize. Okay, so the other thing is that when you're implementing these things, don't believe that, okay, you achieve it and then you can go back to what you're doing before. It does not mean you can eat anything you want at any time you want and that you cannot exercise. Being in that state of cure means that you're practicing the lifestyle changes that are sustaining your state of normalcy. Recognize that those habits are the habits that keep you normal. And once you begin to separate yourself from them, that's when disease begins to creep in. So achieving and then maintaining weight loss is critical to your success. Okay, so if you do it for a while and then it all comes back, then you erase all the progress that you've made. You've got to follow those guidelines for prevention in terms of your food choices, your exercise, and your stress management. You also want to start eating foods that will more help you to lower your blood sugar levels. And I'll mention some of those foods in a little while. And then you have to monitor your HbA1c levels to see whether they're trending in the right direction with these changes. Okay, so you got to see your doctor about that too. Now, if you're on medication and you're working towards achieving that cure where you're reversing your HbA1c towards that normal level, recognize that you still want to follow with your doctor and you still want to remain on your medication, okay? You're not going to stop your medication until your doctor gives you the clear that you've maintained this normal HbA1c for some time. Have a conversation. Okay, doc, I'm doing all these changes. I think this is going to be helpful. Can we wean me off of some of these medications? Take my doses down. Discontinue this one, discontinue that one, and then you'll see whether you're able to discontinue everything and then still be monitored where you're maintaining that level of your blood glucose level. And so that also is very important. And so I want you to recognize that the sooner you make those kinds of changes, the better it's going to be. Okay, but wherever you are, you want to start right away. In general, the longer lasting the diabetes is, so the longer time that you've had it, the more difficult it can be to achieve this normal HbA1c level because of the negative effects that begin to happen in the system that helps with this glucose management. Some of those changes begin to become permanent, but certainly you still want to try to work towards that level, and I would encourage you, wherever you are along that spectrum, to still try. But it can become more difficult, so sooner is better for you.
Oh, Caren, thank you so much. We're kind of running out of time. Do you have the last minute summary for us?
Okay, sure. So this slide essentially shows us what those foods and supplements that I mentioned for lowering your blood sugar are. We see the green leafy vegetables. If you can take a snapshot of this, this is going to be helpful. And then I just want to look into what those long-term complications are. So we did mention some of them. Heart disease, nerve disease, kidney disease, which we're going to look at a little bit more, dementia. All of these on this list here are significant complications of type 2 diabetes if we don't do anything about it. And so as
So,
we
on the long-term effects, I understand that the men's erectile dysfunction was also one of those.
Yes, for sure, and that's a significant one for men because they definitely want to be functioning well. So for our men, I will say, visit your doctor, check things out to make sure that you are performing adequately. So type 2 diabetes is actually one of the leading causes of kidney failure. And so I'm very happy for us to introduce Dr. Porteous so that he can go into a little bit more of this complication and the significant impact that it can have on our health. Thank you.
Well, thank you, Dr. Fadlin. Unfortunately, we are actually out of time. We only have 7 minutes left. So it sounds like what we need is a part two where we'll be able to answer all of our participants' questions and our viewers' questions and really have time to really hear from Dr. Porteous. We are so glad that you were able to join with us, and we really appreciate your time and all that you have done for us. So it sounds like our takeaways from your wonderful presentation is to exercise, start moving any way that we can, moving towards a whole food diet, and the importance of 7 hours of sleep.
I like how you said that.
Well, thank you. Very good. It was a wonderful presentation. We're so sorry that we don't have the time for questions. We want to give a shout out to Uganda, who's here watching with us. And we appreciate, Jonathan, your time with us. Let's go ahead and close with prayer. Father God, thank you so much for bringing to us persons who are willing to educate us on how we can improve our lifestyles and what we can do to better serve you and be close to you. Because as we all know, the healthier we are, the better we can hear your voice. In Jesus' name I pray, amen.